Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niche. Today, I have a special guest, Dr. Rob Kessinger. You can find him at ucspecificchiropractic.com. ucspecificchiropractic.com. Today, we're going to be talking about something that I've actually really not spoken on the show before, so I'm really excited. So our passion here at the show is to get information out there to the masses to see how we can help people better their body and better their mind, healing of whether it's neuropathy or just inflammation. So today we're going to be talking about understanding hyperbaric oxygen therapy, which is called HBOT in regenerative medicine. So today, thank you so much, Dr. Rob, for being here. I appreciate it.
Happy to be here. Thank you for inviting me.
Yeah, of course. Great thing that we're going to be talking about today. But before we do, maybe let us know a little bit about yourself, how you got into chiropractic, and then we'll take it from there.
Okay, well, actually, I'm a fourth generation chiropractor, which means that my great granddad graduated in the 1920s. So our family is a little bit over 100 years in, and my granddad graduated in 1948, my dad in 1963. So anyway, I just say that because that's a proud thing for me. I really love it that our generations have kind of flowed in that way. I have a letter of intent from some of my kids, but that has not been nailed in yet. So we'll see what happens. So
Okay, fifth
all's good
generation.
all's good either way. But in regards to chiropractic, I've my first 15 to 20 years, I did primarily upper cervical chiropractic, focusing on getting people's heads straight, getting their head on straight and so on and so forth. You heard your mom tell you before, hey, is your head on straight, so we did a lot of that. And through the course of just different life events, I, got into what's called chiropractic internist work, and what a chiropractic internist is it's a board certification, which I actually teach in that program now, but it's a board certification, in natural medicine, really, and, that's kind of the brunt of it. We do a lot of, like, functional medicine stuff, but it's a bit more elaborate than that. It's a pretty cool program, but as a piece of that and I do a lot of blood work, a lot of comprehensive exams. We do a lot of things and searching, searching out, what causes problems driving. But HBOT, or hyperbaric oxygen, has been something that I've utilized probably for not quite, but nearly about 20 years now.
Mhm.
So I've had a
Wow. Well,
few reps with it.
okay, a few reps. What actually, well, like, what inspired you to even get into that arena?
Into the HBOT? Well, there are a couple of things. Of course, there's traditional uses for your HBOT that are
Hmm.
FDA approved. People have diabetic ulcers that don't heal, or burn
Right.
burn people, or different things that hyperbaric has actually they have ICD-9s for, and so on and so forth. And we use that for some of that, not the emergency stuff like burns, but we do use it more for the off-label stuff, and so that's what really intrigued me. What first intrigued me about it was in 2007, I had my own health crisis. In 2007, I came down out of nowhere sarcoidosis. The sarcoidosis affected my lungs, but it actually also, and more importantly to me, because it had more impact, it impacted my spinal cord. And so, as a part of the rehabilitation of getting my limbs working better and getting my body working better after that, hyperbaric was an important piece of that. It wasn't the only thing I did, but it was an important piece of me having restoration from that. So that was really what put it on the radar. So that's 2007. So that's how
Wow.
long I've been involved in the hyperbarics.
Okay. Well, that's very interesting. Well, good enough reason to try it on yourself, now to help others.
I always try anything I, put on my patients. I always try it first, because I've had some things like that have come down the pike, and people
Hmm.
say, "Oh man, this is the greatest thing ever." And I try it and I'm like, "Man, that made me sick." Or whatever. And I'm like, "Okay,
Yeah,
maybe
like,
not
we're not
so
doing
much
that.
so." Right, exactly. We're not doing that. So I always like to make myself a test subject first before I foist it onto others. So
Okay. What would you say that are some of, like, maybe more of, like, the specific conditions that have shown major, like, improvement with HBOT in, like, clinical studies or even in your office?
Yeah, I can go over clinical studies are all over the place, but clinical experience, I
Right.
would tell you that there's really kind of, 3 baskets
Mhm.
of people, if we can put it that way. One basket would be brain-based. People who've had strokes, uh, traumatic brain injury, even mild traumatic brain injury,
Okay.
uh, early onset dementia, mild cognitive impairment, all the way down to autism. Anything that deals with the brain tends to have tends to do well in hyperbaric. And the reason why is because it super saturates the brain with oxygen and really gives the brain the energy it needs to heal itself and do the things it needs to do. So that's one basket, these kind
Okay.
of brain-based things. Another basket is chronic infection. Things like Lyme disease, people are suffering with that. Long COVID, that's a big one that's come down the pike lately. Epstein-Barr, chronic fatigue syndrome, fibromyalgia, and there's very specific mechanisms. I hope we are able to get into some of that. We'll keep it in simplistic, but it's there's some cool mechanisms that really pop out for these conditions. And the third basket is just kind of health and wellness, longevity in that basket. And there's one just offshoot that we use it for as well, and that's pre and post operation. Somebody's having dental procedure or they're having a hip replaced or something like that. If you'll get in that hyperbaric oxygen 2 or 3 dives a week before and a few dives afterwards, your recoup time, and this is supported by the literature as well, your recoup time is really significantly improved.
Well, so when I hear of like hyperbaric chamber, for those people out there in internet land, they don't know what that is. When I think of hyperbaric chamber, I'm going into an actual little chamber, and it's going to be freezing. And do I feel anything? What is a hyperbaric? What is it? How can you explain it to somebody out there? So when I hear say it hyperbaric, I'm like I'm going into a chamber, the king's chamber, and they're locking me in. I mean, how does this work?
Yeah, no, I get it. In fact, in 2007, when I had my own experience, I had the same feeling. That's exactly what I thought. But what I found was that if you get the right chambers, you don't feel that. Like, you don't feel the that cl we have people that's claustrophobic that can actually get into our chamber because the way it's designed, it's very comfortable, there's a lot of glass in there, and obviously, if you have a pathology of claustrophobia, you may not be able to do it, but people who think, "Oh, I'll be afraid to do that," they're actually welcomely surprised. They're like, "This is not as hard as I thought it would be." So that's one aspect. Now, the other aspect is that you have to change pressures. So if you think about it, if you ever went like when you're a kid, you dove off the diving board and you went like 10 feet deep in the water. Did you feel
Here's
that
pop.
pressure in your ears? Right.
Hmm.
So we take people up to 2 atmospheres of pressure. Now, some people will use 1.3, 1.5. It depends on the case, but we'll go up to 2.0 atmosphere. What that means is, for me and you, is it's like going 33 feet underwater. That's it. That's 2 atmospheres. So if you can imagine the pressure that you have, but you don't feel it that intensely as you go up. It takes about 10 to 15 minutes for us to have you in the chamber to get you that pressure. And if you can handle going up and down on an airplane, generally you can handle this. There are some people who have ear problems that they can't handle it, but for the most part, we don't see a lot of trouble with that. And you've got mechanisms, have people chew gum, blow out this way and kind of equalize the pressure, and people don't have as much pressure. Now, here's the interesting thing. Once you get up to pressure, you don't feel it at all. You're just
Okay.
there. Like, you don't feel it at all. And then when you come down pressure, you have the same thing. We let down the pressure in the right manner so that it kind of reduces the amount of that change. But going on to, if I may, going on to the hyperbaric, the main thing that the hyperbaric oxygen does is this. You can think of it like this. When we're breathing air, we're breathing just a little bit under 21% oxygen. That's pretty much wherever you're at. Now, if you're in Denver like I was a couple of months ago, you're probably breathing less than that. I don't know. But when higher atmospheres, you're going to have less oxygen. You know how that works. Ground zero, you're pretty much about 21%. Now,
Mhm.
oxygen has to take a ride on your red blood cells. So, as blood leaves the heart, it goes to the big vessels, smaller vessels, smaller vessels, smaller vessels, and then it gets all the way to the tissue level. Now, it's a fancy word, but it gets to what's called a capillary bed. That capillary bed is where all physiology takes place. It's where everything takes place. That's where you exchange oxygen, pick up the carbon dioxide, you pick up the waste, you get the nutrients in the cells, you do all that kind of stuff. Well, the way it works, only one red blood cell can fit through the capillary at a time. Now, you have more than one going through there, but you can only have one. You can't because it has
Right.
to have a real snug fit because you're exchanging gas, you're exchanging oxygen. You can't have a little Jimmy going on there. You got to be very snug. And so, in order to get oxygen into tissues, that has to be in good order. Now, here's the thing though, that when you've had an injury, just take a stroke, for example, or brain trauma, around the epicenter of the injury, you're always going to have some residual edema or swelling. You're going to have a swelling. And the
Mhm.
way circulation works, it's all based on pressures. So you're always going to go from higher pressure to lower pressure, so on and so forth. That's the way blood flow works. So if you have a capillary bed that's being squozed in because of that edema, then the red blood cells can't get in that capillary bed as well. And that very tissue that's starved for oxygen so it can get energy to repair itself can't do it. So what hyperbaric oxygen does is this. There's two basic principles. Number one, when you get under pressure, like 2 atmospheres, there's 2 laws that are in play, and I don't wanna bore you with these laws, I'm just gonna say the laws for people who like to search things out. There's one that's called Boyle's Law. 500 years ago or so, the dude made this. They didn't make it up, but he discovered this,
Mhm.
and what he found was under pressure, gases shrink. That's the first principle. The second principle is Henry's Law, and this means this: under pressure, gases can convert into liquid, and this is the beautiful part. Because when you're breathing in oxygen, under pressure, the gas of oxygen, which is riding on that red blood cell, no longer needs to ride on the red blood cell. It turns into a liquid and it supersaturates these little bitty molecules of oxygen. And the cool thing about that is that oxygen can get into all those little nooks and crannies that are starving for it, that need it to revive the energy. So that's one basic principle that goes on there. The second one is this: we have people breathe in, give or take 2 or 3 degrees percentage oxygen, 93% oxygen. Now, we do not use 100% oxygen. The reason why I don't do it is because just safety reasons. Now, you can do it safely, but you've got to go through a whole lot of stuff to make sure, and you got to have an oxygen tank on the other side of your belt. There's just a whole bunch of regulations, a whole bunch of stuff, and safety percent, you're not in that level of fire risk, blowing up the chamber risk. You're not in those. So I like the 93%. So you put 93% oxygen in, you get under this pressure, and it super saturates your blood with oxygen.
Wow, so let me get this straight. So the main thing is getting into the blood red cells
Yeah, oxygen has to get into the
to
red
let that
blood
breathe,
cells
to have flow
normally.
better.
But here's the thing, when you're in hyperbaric oxygen, it bypasses red blood cells, and the oxygen molecules are liquid now, and they free float in the blood. So the capillary bed is not an inhibition anymore because little bitty oxygen molecules can get everywhere. They're not outside of the red blood cells.
Would you
Does
feel
that
the
make
difference,
sense?
right? Will you start to feel the difference? Because a lot of people don't know about
Okay.
this.
Right. Okay. So here's an interesting thing. If you do 1 to 3 dives and you feel better and then you stop, then that feeling that you got from that will probably dissipate, go away.
Mhm.
But if you do 1 to 3 and you do have a positive response, that's a good indicator that if you go through a series of 10 or 20 or whatever you need, that your results are going to be more permanent because of other factors that we can talk about.
So what would be a good response? Like, I mean, What does that look like?
Okay, so that's a good question. So let's say somebody has brain trauma. You know, they've had a TBI, and they come out of the hyperbaric chamber, and they're like, "Wow, I can focus better. My word finding is a little bit better. I
Okay.
have a little bit more
More
energy,
cognitive,
more
no brain
cognitive."
fog, probably.
Or we'll see like a diabetic ulcer that's not healing up, take through 3 dives, and all of a sudden where that hole was not healing, now we start seeing it begin to recede. So those things can happen. Now, diabetic ulcers, my experience, generally take 5 to 7 dives before they start kinda seeing that
You're
come.
saying dives, right?
I when I say dives, excuse me, because hyperbarics, actually, the first hyperbaric chamber was by this dude by the name of, like, Henslaw or something like that in 1600. He had this idea of using organs to not body organs, but organs that you play, and piping that into this isolated chamber to increase temperature, but or the pressure. But he didn't have oxygen. They didn't know about oxygen until the 1700s. But anyway, he used that. He was like a clergyman, and he used that as a health thing. Anyway, that was the first guy. But who made hyperbaric famous was our Navy, because when people get the bends, when they come up out of the water too fast, what's happening there, when you come up out of water too fast, nitrogen gas converts, I'm sorry, nitrogen liquid converts to a gas bubble in your blood. You get enough of those, problem. So you get somebody in a hyperbaric chamber, it shrinks those gas, converts them into liquid, just like I was talking about. And then that was a saving grace for so the Navy divers and so on and so forth.
So this
So,
was
so
made for
when
the
we say
divers.
yeah, so when we say a dive,
Yeah.
that's kind of what they're talking about. It's like you're diving underwater
That
30 feet.
makes sense.
In the hyperbaric world, HBOT world, we use the term dive. You can call it a treatment session or whatever, but we call them dives.
That makes sense.
I'm glad
So,
you asked that,
yeah, that's very interesting. I learned something new today. It's called a dive. Because like, why is he saying dive?
right?
You know, I'm like, are you going under?
Right. Yeah, are
Interesting.
you going underwater? No, you're not.
Yeah, I know how you're like, I'd be scared. I'd be like in the chamber. I'm like, okay, am I going to see water? So is this
Water's
is this really expensive for people to do, or how does it? What does it
It
normally
depends
run?
on where you're at. It
Okay,
depends on where you're at. You can have a session from anywhere from usually around $90 to $150 a session,
a
somewhere
dive.
for one dive, but they will do, um, packages. Generally, people do if you
Okay,
do 10, you get a discount, you
right.
do this and that, and so on and so forth. But it really
The area.
depends on where you're
You're
at. Like,
right.
you're in California, it may be different than it is in Missouri.
Right. Well, it's so I'm noticing that a lot of people are starting to use HBOT in like even workout places, which is
Yeah,
very interesting.
yeah. So there's an interesting phenomena that happens. So there's two, I'd like to talk about baskets because it's kind of easy to wrap our heads around, but there's really two baskets of things that the hyperbaric oxygen is really doing. And the first one I already detailed with the laws and the gases
Right.
and so on and so forth. I don't want to detail that again. So to be redundant, but the first thing is super saturation of oxygen. And it depends on what report you read, but some reports say that you have approximately 400 times more free floating oxygen, free floating outside of red blood cells doing their own deal, in when you're hyperbaric oxygen state. Now, here's the interesting thing. This is the second basket, and this is something we just really begin to learn about 19. There are these 3 guys that won a Nobel Prize in medicine, uh, finding kinda codifying, our body's response to hypoxia, which means low oxygen.
Okay.
So, phenomenal work they did. These 3 were not working together. They were separate places, all wrote papers, and they looked at it and said, "You guys are all saying the same thing." They gave them the Nobel Prize, wonderful thing. But anyway, so here's what happens. And we find this amazing, and this is why they're in gyms, and this is why the longevity picture and all of this kind of thing, right? So When you have 400 times, and give or take, I don't, I'm not, that level changes depending on what study you read, but let's just say, give or take. So 400 times more oxygen free floating in your blood. You're in a session for an hour, maybe an hour and a half. You come out of that session, that free floating oxygen content drops dramatically. And because you're going back to normal levels.
Right.
Does that make sense? So you're
Mhm.
high
And you
and
go low.
then you go down, right. So that free fall activates something called HIF1 genes, HIF genes. This is what the Nobel Prize folks were talking about. You have HIF genes in your cells that will detect low levels of oxygen. And when you have low levels of oxygen, it will activate certain things to happen. One thing that'll happen is it'll activate the production of stem cells. Now, we all know about stem cells.
Yeah.
When we can marshal up our own stem cells, pluripotent cells go anywhere. This is the key to restorative medicine right here. It is like the big deal. Stem cells are important for regenerative, restorative medicine. I'm sure you know all about that.
Oh, yeah.
But you're unleashing your own stem cells when you have that drop because you activate these HIF genes. Another thing that happens is this. When you activate those HIF genes, you activate something called VEGF or VEGF, which is vascular endothelial growth factor. And this is key because it helps you build new blood vessels. So now you're not only building more stem cells, but now you're building better circulation. Better circulation means better life. So when you drop, it's that reaction that your body is in this state of like, oh my goodness, I lost oxygen. And it activates these genes that start promoting it. It also promotes less reactive oxygen species, which is better for your mitochondria. It also does this. It actually protects the mitochondria. Now, this is a whole new subject, and I don't want to go too far in this and bore everybody, but this is important. Mitochondria are the powerhouse of the cell. If you tell me somebody has fatigue, I will assure you they've got problems in the mitochondria for whatever reason. You got to figure out why. But you got a problem in the mitochondria. You're not converting food into energy efficiently. So mitochondria is where we make energy. Well, mitochondria, because they're dealing with so much electricity and building energy, they can break down. And when they break down, they go through this process called mitophagy where they break down and then they rebuild. They break down and they rebuild. If you do this well, you live well. If you don't do this well, you're tired, fatigued, overweight, different things can happen. So, watch this. When you activate these HIF genes, you activate mitophagy. You activate the repairing of the mitochondrial process. So this is the reason why these three reasons right here, and probably more that we're going to discover as time goes on, is
Mm.
why longevity medicine is really goes together well with HBOT, but also your chronic Lyme disease, fibromyalgia, long COVID, all these hypercoagulation reactions do very well with this as well.
Wow, you said a lot.
I'm sorry,
But
I meant to break
no,
that
it's
up.
okay. It's all good. My brain can capture this. So you caught me on the stem cells. Is there an actual? I know you don't know the actual number, but about how many stem cells are coming alive from this, or that we're producing?
Okay,
Average.
so this is actually a new understanding. I'm
'Cause I've
talking
never
about
heard of
over the
that.
last years, so they're still ferreting this out. The only thing we know, and this is what the studies are showing, is that it does activate the release of stem cells. I'm not sure we know the number. And, just thinking about it from a physiological standpoint, it's probably going to vary from
Mm.
person to person depending on what's going on, their health, their age. There's going to be different
Inflammation.
factors that's going to, yeah,
Right.
it's going to determine really, if are they on medications. There's going to be different factors that's going to determine how much you're able to release.
What are the things that you've seen amazing about the stem cells? I didn't know anything about. It makes me actually want to go jump in a hyperbaric chamber right now because we're losing stem cells every day mm, as we get older. But what are some of the things that are very interesting that you've seen help people with? Maybe somebody came in for just to try it. And then all of a sudden they're like, "Well, doc, I don't have this anymore, or I don't have this anymore." Not saying that that's what it does, but
Yeah.
you saw it in your clinic.
So this is interesting. Um, I okay, I had a guy that was having, prostate issues, and so, he was about, 60, and, so he was having problems getting up to go to the bathroom 3 times a night, and he's trying to go to the bathroom, it's hard to go, and all these different things. I apologize for getting into all that, but that's, it's kinda life that happens when people get
Yeah.
older. And, we had him in the hyperbaric oxygen for other reasons, but he comes back and he said, "Man, I'm going to the bathroom normal. I'm not getting up at night anymore." And that was the only thing we could attribute that must have been the thing that happened. So, anytime that you're improving oxygenation to the body, anything can happen. But
Wow.
I would say the biggest offshoot is when I'm not working on somebody with brain-based issues, they'll come back and tell me their brain's working better. Like somebody comes in, they got a diabetic ulcer, they have maybe a sports injury or whatever. I hear people come in, they'll say, "Wow, my brain fog's better," or I've got more clarity in my thinking. So I think the brain loves oxygen. The brain loves fat, good fat, and the brain loves oxygen. So
Okay, I like that. Now, how long would you say that kind of like a typical HBOT treatment cycle would last, and like what is the frequency of those sessions?
that's a great question as well, because when somebody comes in, it depends on their circumstance. He's having an operation, hip surgery or whatever, 2, 3 before, 2 or 3 after, that's its own deal. But just in generality, let's say somebody comes in with a stroke, traumatic brain injury, Lyme disease, or something like that. We want them to get in there consecutively a lot the first month. It's really important. And why is that? Because if you have that frequency, then you can build new blood vessels. Can All the stuff you get from those activation from the HIF genes I was talking about, that goes in overdrive if you can get enough sessions in. I like to have people do at least 3 sessions a week for a month. That's a good starting point. They can do every day is even better, but 3 days a week is kind of a sweet spot. You get to 1 day a week, you're gonna feel better more than likely, but you're not gonna get the long-term benefit. But you don't have to keep on doing that. Once you go through a month, and some people have to do 2 months of that, once you go through a month or 2 of that, then you can go to once a week, once every 2 weeks, once a month. It's kind of a tune-up, and you do just fine.
Wow. Okay. So what you're saying, would somebody maybe utilize this almost kind of like a chiropractic treatment? Meaning, my opinion that you and I'm not a doctor, but I think that people should see a chiropractor at least twice a month. That's my opinion. Of
Right.
course, a chiropractor would say once a week, but my point is, or more, depending. But my point is, say twice a month. Is this something that once you kind of do it, you kind of like, wow, feel the difference. I should maybe possibly do like maybe if you do it 2 months straight and then do like a tune up like once or twice a month.
Yep.
Is that
I
kind of
I
what you'd
agree
recommend?
100%. So, we've done hyperbarics for 20 years in our office, and going back to the word dives, I have no idea how many di and I wish I'd have recorded all of them. But I don't know how many dives I've done, but, I mean, it's in the hundreds, so, it's something that, yes, if you did it once a month, once every 2 weeks or whatever, you would feel the benefit of that. So,
Mm.
you may not walk out like, "Oh, I walked out of the hyperbaric chamber, man, I feel zippy and great," but you extrapolate it over time, and you're like, "Yeah, this thing is really benefiting."
Okay, what's one of the first things that you noticed right away? Was it just clarity or more energy or?
Yeah, so I have to speak, on that. I hear from people, but speaking for myself, I'm going to say brain fog clarity is a big thing. But if somebody, I've heard people tell me their energy's better. Also, I didn't tell you about this. Sleeping. Some people who are having problems sleeping do very, very well with hyperbaric. Now, I'm cautious to say that because there are many reasons for people to have problems sleeping. And if this isn't your problem, it's not going to help. But certainly, some people have been helped by with their sleeping, and it was an offshoot thing that we really weren't working on. So,
Mhm. Okay. What would you say that you're seeing that are probably are there some potential, like, risks or maybe side effects that are associated with HBOT?
the biggest side effect that we're going to see is going to be the ears. So if you can't tolerate that, or if you're extremely claustrophobic, you're
Sensitive.
probably not gonna be able to get in there. So we don't really see, other side effects, from that. Now, if you like I said, if you do have ear problems, let's say you have an inner ear infection or something like that, you really should
Mhm.
not be in that chamber. So I am careful about putting pregnant ladies in there. And if you read the literature supports the use of hyperbaric oxygen for pregnancy if there's a specific reason for it. Like a lady has, she's got a burn or something's happened, and it's probably safe. But I would not like if I had a pregnant lady, she comes in, she's 12 weeks pregnant. I'm not putting her through 3 dives a week for a month. I'm not gonna do that. So I'm gonna be cautious about that. But, I'm cautious about, doing herbs. I'm just cautious, through
Right.
the pregnancy time.
I don't blame you. How about somebody with glaucoma or things like that?
Yeah, that's actually, shown some improvement for glaucoma. And it's a good question because what about the pressures? Is that pressure,
It affects the
going to
eyes.
affect?
It should.
That's right. So when you fly in a plane, you get up about 5,000, 5,500 feet. And so they do some things to equalize pressure to the plane so you don't feel that
Mhm.
quite as much, but you still have a pressure change. So we generally haven't seen a problem. I haven't seen a problem with that.
Okay, wow, interesting. What would you say the most coolest thing that you've seen with HBOT that you're like, wow, I don't believe it actually did that, but it normally doesn't do that?
Okay.
Maybe
So
maybe a specific killing in the body, but somebody said, wow, it did this. Maybe they don't have any more numbness. I don't know. I'm just making something
yeah,
up.
I would say, uh, the more surprising things, and I've seen this on a few, more than one. Somebody who had a stroke, who had loss of function 5 years ago, and they get in the chamber and they start getting better function, not perfect function, but they start having better function. And if you've ever dealt with somebody who has loss of function, an improvement of 20% function is very welcome. So
Right.
there's an interesting thing that brain surgeons actually taught us. And what they found was something called a penumbra effect, which goes along with this. What a penumbra effect is this is what the brain surgeons actually explained, and they've written this in the literature. They would work on a place of the brain, not with the eyes or the ears. Somebody comes up out of surgery, now their eyesight's improved or their eyesight was returned, or they couldn't hear, now they can hear. It's an odd thing. It doesn't happen very much, but it happened enough that they were curious. And what they found in their explanation was when they did the surgery, it improved the blood flow into a specific area. Now that area is lit up. So they're like, how did that happen? It doesn't make sense. Because if a brain cell doesn't have adequate blood supply, we think of the brain
Nice.
cell dying.
But
But
it comes back, doesn't it?
right, but they say that the brain cell actually lays in what they call a penumbra. And that penumbra effect is it's not dead, but it's not functioning. It
Dormant.
just has it's dormant. A perfect example. It's a perfect word. So it's laying there dormant. It has just enough oxygen, just enough glucose to keep it alive, but not to thrive. And so that's what we see in some of these post stroke victims. 5 years, 7 years ago, they had a stroke and they can get in that hyperbaric oxygen. I don't want to promise the moon to anybody. I don't do that. But we see in some of these cases that even though it's been that many years, that we see improved in function. That's probably the most surprising thing because you
That's
think that
huge, though.
once function is gone, it's gone.
Especially with, like, glaucoma, and I speak of that because I got glaucoma at a young age,
Wow.
and it hit me really hard, and what was interesting is they were saying that at least the doctors were saying this, that when a cell dies in the eye, that's when you're not able to see as clear, and once it dies, right? But
Yeah,
then there's been other studies that they can come back to life,
that's interesting.
which it's very
That's
interesting. And then
interesting.
as I'm talking to this one doctor, I went back, it was like 3 years later, and they said, "Wow, your eyes have gotten a little better." And then they stopped themselves. And they said, "Well, it's kind of the same."
Yeah.
But I go, "Wait, no, 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 no. You said it got better."
Right, right, right,
Because then they would have to explain that a cell can't come back to life. So it was
right.
very, very interesting. You know what I mean?
And I don't know anything about this because I know a considerable amount about stem cells, but I don't know much about glaucoma and stem cells. Are there any studies, or they're thinking about that, or do you
There
have any?
is. They have some right now where, which I'm not going to be a guinea pig for it. They have some where they do the stem cell shot inside the eye,
Yeah,
and so the eye goes for where the inflammation is, and
yeah,
they think that there's possibilities. They've seen some people actually get their sight back, some,
right.
but it's
Yeah,
not enough for me to go, hey, I want to give it a shot. You know what I
yeah,
mean? Because you could, it's the eye. It's the most hardest thing to fix in the body. But the thing about stem cells, as you know, is that we've done studies where you can get a half a heart, cut a heart in half, stem
yes.
cell, and it'll grow the exact part back. So they're thinking maybe they could do something like that with the eye, but it's still too fresh and new.
I agree 100% with that. I am optimistic about the stem cell world. We use it, we've utilized it, and we even have a retired orthopedic surgeon that does stem cells in our office, and so on and so forth. And it's intriguing, but I agree with you. We don't know everything yet, and I'm sure we will figure it out. As fast as things are happening now, hopefully within the next 4 or 5 years, we're going to really be a lot farther down that track. So anyway,
Well, I think so, but I'm really excited, with regenerative medicine.
yep,
It's a passion of mine. I've been doing it since 2008, and that's why I like doing these shows. And because I'm learning all the time, and not only that, but we need each other because
yeah,
I could be in your area like, oh yeah, I know a guy in Missouri. You never know,
right,
or I have a friend in Missouri.
yeah,
It's always, it's kind of like the old school saying, it's not what you know, but who you know.
right,
It's really true. But with stem cells, what gets me excited is that we we haven't hit the what's the word, the precipice of it, of
yep,
where
I
it's
know,
about to go.
yep,
And I remember when COVID hit real strong, I knew some doctors that I stay friends with and had on the show. And they told me, well, hey, I'm doing this, but keep it on the down low. And what they were doing was they were getting people to come to their office that had
mhm,
COVID, and they were injecting the stem cell
right,
inside their body, and it was healing them automatically,
yep, yeah. I don't
which is
doubt that.
very interesting
I don't doubt that. I don't
because
doubt that.
because it attacks the inflammation.
So I
You
actually,
know,
it's interesting you say that because I'd actually read some reports of infusing like 2 cc's of stem cells
yeah, uh-huh.
and having that remarkable thing. Long COVID really is, it's amazing because there's so many people that's suffering for that. I'm actually testing for that. You can test if people still have spike antibodies that are causing problems. And we see a number of folks that are still kind of dealing with that. And going back to the HBOT, it's a wonderful tool, to
Mhm.
help that hypercoagulation because that's really what the long COVID's doing, and if you would say a unifying theory for long COVID, meaning that we see this in all cases, it's gonna be the coagulation. There can always be other things, mast cell activation, autoimmune, you got your autonomic nervous system, POTS, all that can belong to long COVID, but all of it has as a central theme is this hypercoagulations.
Interesting. I had another question to ask you. I
Yeah,
don't know if it's related, but
yeah,
with HBOT, I remember. So I have a good friend. His name's Dr. Andy Barlow. He's one of my close friends, and he's just amazing doctor. He's up in Mississippi, and I remember looking at his. I call it a toy shop. You know,
yeah,
his office is like a toy shop to me. Just all these cool little, like Batman. Where does he get these wonderful toys?
right.
And he has this one machine where it's like you're on a bike, but they put the
That's
mask
right.
on you.
Yep,
Does it have to
that's right.
do with HBOT or some type of?
So, the first part of the question is, I am a good friend with Andy Barlow.
Get out of town.
Yeah, I know him.
Yeah,
He's a good
we
guy.
work together. Yeah, we work together all the time. Actually, we're working on a
Well, you
podcast.
tell him yeah, you tell him you had me on today.
Hey, as he sounds, Doctor Andy Barlow. That's right. Hey, have you seen his car? I love this guy. We're all recording. He'll listen to this probably later.
Right,
But
that's good. So, okay, so it's all right, you're getting the oxygen in, and I don't like the word magic, so I'll use a different word. Where you get the juice from hyperbaric is the pressure because of Boyle's law and Henry's law. That's what converts oxygen into a liquid and lets it free float away from the red blood cells. When you do that oxygen, you're hypersaturating the red blood cells, which is good, but you're not getting the free float. Does that make
okay,
sense?
makes a lot of sense.
Yeah.
Yeah,
And
yeah,
I'm
because
not
I
downing
saw.
that. I think
Yeah,
it's a wonderful therapy.
mhm, yeah, yeah. So I noticed that. So you think that's a great therapy, kind of
Yep.
like hand in hand? You're just saying.
Oh, sure, absolutely. So what it's just it's 2 different things. Even though both of them have to do with oxygen, it's 2 different things. The delivery system is a bit different. When you
Okay.
exercise real hard, you're breathing in that oxygen, it hypersaturates your red blood cells and helps that be more efficient, and that's great. But the
Mhm.
hyperbaric oxygen, the juice you get from that is that free floating oxygen that can go into all those little nooks and crannies and heal areas that cannot heal because they're saturated with too much swelling.
Wow,
Yeah.
that's crazy. Okay, I've
Yeah.
always wondered about that. I never really. I don't even know why. I was just like, oh, it's just a bike with a little mask. I was like,
Yep.
whatever. How's that going to help me? Yeah, I was at one of his seminars. I've actually been to quite a few, but it was one of his seminars, and I was like, everyone's jumping on this bike and they're getting so excited. I probably should have just
Right.
jumped on. Now I'm like, just give me the hyperbaric chamber, please. You know,
Did you try the bike?
I didn't. I There was so much going on at the
Yeah.
conference that like
Yeah.
I said, there's just so you're like a little kid in a candy store.
Yeah.
I always buy like whenever I go to the conference, I'll like buy something there for I'll be honest for a nice tax write off if I needed.
Right. Sure.
I like the
Yeah.
Beamer. Like I love the Beamer.
Oh, yeah.
Which
We use that.
I need to get that sucker back on because I heard that a lot of people are utilizing the Beamer and they're actually getting their eyesight back a little bit where it's activating the old stem cells,
Yep.
stuff like that. And I'm not a doctor, but I know that I'm thinking if I were to wrap it around in my head, and if I'm struggling with, we'll say long COVID or brain fog, that should be able to start to help because I know that the Beamer's really precise on the blood flow. And wherever there's blood flow, that's where there's healing.
It's interesting. Again, a lot of things you're saying is very interesting to me.
I'm
So
just throwing
so the
ideas out
Beamer
there.
the
Right.
Beamer,
Uh-huh.
it's like if you look at the physiology of Beamer,
Mhm.
what it does is it helps circulation at the capillary bed.
Okay.
So it doesn't do the same thing as hyperbaric, but it's along the same kind of principle of improving blood flow at the physiological level, which is at the cell level, so the capillary bed works better. One thing that happens when people get inflamed, their red blood cells start kind of sticking together because there's a activation processes through the
Mm.
platelets and different things. It's a complex thing, but these red blood cells are kind of clumped together and they don't fit in the capillary bed as well, and they don't exchange oxygen as well because they're all clumped together.
Mhm, mhm.
What the Beamer does is it changes the electrical pole of them, and then all of a sudden, then they separate, and now you get normal oxygenation. So it's a wonderful, wonderful tool.
Interesting. Yeah, I have the whole shebang where I've got the mat and
Yep.
then the little
Yep.
B I think it's like a B dot or something
Yep.
like that,
Yeah.
which they also say that helps with wrinkles, believe it or not. I don't try it, but I've heard people that actually doctors say it does.
Yeah.
Yeah, I
You
know
don't
we're all
need any help
talking
with
about HBOT, BBOT.
you don't need any help with wrinkles. You're
Oh
far too
no.
young for that.
Actually, I'll be 50 in August, and one of the things that's going to be a
Right.
gift to me is I want to do the vampire mask where they spin your blood and they put it
Yeah.
into wherever you have back into your face, which is good because I'm not going to put pig in my face,
Right. Yeah. That's right.
which is more healthier for your own blood.
Yeah. Sure.
But
No, I
thank
think
you so.
that's
Yeah,
great technology as well. So as you
you know,
keep on naming these technologies, we're gonna keep talking about
I know.
all this stuff.
It's hilarious because I took an exosome shot an exosome
Okay.
shot, over at Andy's, and, it was oh my gosh, my back was just, like, killing me, and then all of a sudden, I took it. I had the best sleep that I ever had in my life that night, and then I had no pain, and then I started
What
using Shockwave. You ever heard of Shockwave?
Yep, yep,
Okay, so I love Shockwave.
I do too.
I
You can
mean,
definitely tell you're getting something when you get it, right?
oh, no, no, no.
Quick
Okay. The good thing about Shockwave, if I were to sell to people, and I don't have a Shockwave or a
right.
license, but if I was a doctor, I would have a bunch of Shockwaves. I'd have that office filled with people that struggle with neuropathy or any type of pain
Yeah,
because
you bet.
you're going to feel your dollar right away. Because a lot of people will
Yeah.
say, I don't feel it. No, you're going to feel it. Because
No,
if you
you
don't
feel it.
feel it, then you're not in pain.
Yeah.
You know what
No,
I
it's
mean?
wonderful. I've used that for myself. I don't have one in my office, but I've used that, for myself, and, yeah, it's great technology. We used ultrasonic units for years, but you
Mhm.
get in and get a soft wave, man, you're just getting way in there, and people will feel it. They do feel it.
And the cool thing is people love those packages because,
Yeah,
um,
yeah,
I've seen people where they haven't bent, like frozen shoulder, and all of a sudden they're like, I
yeah.
can move the darn shoulder. How about the Hockamed?
What's that?
You ever heard of the Hockamed?
I have not. Now you
Oh
hit
wow.
something I haven't heard of, so let's hear.
Hockemed's kind of it's kind of like a shockwave.
Okay.
It's just a little bit less, um, and it's of course half in price. I mean, you've got you those machine. I mean, I think that machine I just mentioned, the one that you heard about, Shockwave, those are like, what, about 100 grand?
Yeah, anywhere between, from what I understand, about 80 to 100.
Yeah, and then you gotta pay for the
You gotta
shot.
pay for the clicks. Every click counts.
Yeah, that's an out of blame we're going on.
Yeah.
And I know, huh?
I
Watch
I think
goes,
it's
"Yeah."
interesting.
Yeah, it's very interesting, it's funny, I'm supposed to be seeing, I know that, Doctor Barlow's gonna be up in Texas. He's gonna be doing a neuropathy course, but it's interesting, I saw him do a teaching on a frozen shoulder.
Yes.
And he literally, if someone goes in with frozen shoulder, he can do it to where there's like he meets with him twice, gone.
Really?
I
That is
mean, that's
phenomenal.
and he teaches that, and I was like,
Yeah,
I'm over here. I'm not a doctor, but I'm like,
yeah.
I'm all recording.
Mhm. Well, if you think about this, if you're 55 years old, you've got a frozen shoulder, and you don't get that repaired, it's a very big hamper in quality of life. So if you can go in and get 2 sessions or 10 sessions and get that better, what's the value of that, right?
There's no
You can't put a
price.
price tag on that.
No,
So it's
yeah,
wonderful what he's doing.
no, 100%. But thank you so much,
Yep.
Doctor Rob. This was fun, man. I don't actually don't even want to get off. I'm like, we can just keep on talking. I'm like, hey, grab a beer, we'll talk. But
There you go. There you
But
go.
yeah, this was awesome. Now I understand what a dive is,
Now you
and
know what a dive is. That's
w-
good. Well, this has been a
where we
lot of
get
fun
that.
for me. It's been an honor and a privilege. Thank you so much for inviting me to be on this program. I love your podcast. You're doing a great job with it.
Man, I appreciate you and everyone out there. Make sure you go check out Dr. Rob Kessinger. You can go to ucspecificchiropractic.com. And if there's one thing that you'd like to leave with the audience, what would it be?
Well, the first thing is my website is actually
Wait, isn't that's not the
drkessinger.com.
website?
That's not the website. So
Wait a
it's
minute.
it's drkessinger.com. So it's drkessinger.com. That is my website.
You know what's weird is that
What?
that's what popped up.
I don't know why.
Wow, okay. Now I'm like, I was kind of at first when I was looking, I was like, this is an interesting name. Why would he do that?
Yeah. No, it's drkessinger.com.
You
Oh,
kept it
okay. So
simple.
you asked me a question. What'd you ask me?
Yeah. I said, if you could leave with our viewers, what would it be about like HBOT as in encouraging them to at least try it?
Yeah. Oxygen is what makes life work. All
Mhm,
oxygen revolves around, all life revolves around oxygen. The better you're able to utilize oxygen in your body, the longer you live and the less chance you're going to have for sickness and disease. So
mhm,
oxygen is the key to life. We have a technology now through the hyperbarics that will allow oxygen to get into your body in a super saturated, safe way that'll light your cells up. Now, from a practical standpoint, if you do a few dives, most people will respond that they feel better in some aspect of their life. They feel more energy, their brain's working better, their joints don't hurt as much. They'll feel something generally within a few dives. And if you do feel that, that's encouragement that you want to go ahead and do that 10, 12, 20 dives, whatever you need, so you can get more permanent results with it.
Okay, awesome. And your website one more time?
Kessinger.com. And it doesn't have a dot in it. It's DRKGER.com.
Thank you so much. I appreciate you, and I could tell I'll probably have you on the show again. This was fun.
All right. Well, we can talk about a lot of different things. So
Definitely.